I arrived 3 days after the devastating earthquake that hit Haiti and was met by a scene of complete devastation. Hundreds of thousands of children and their families were sleeping on the streets without any access to food or water or any kind of medicine. It was a really dire situation. Within hours of the earthquake striking, Save the Children was able to mobilise resources within Haiti but also internationally to mount what was one of the largest responses the agency has ever mounted to a disaster. We were able to start to bring food and water in from the Dominican Republic, as well as fly in other crucial materials like tents and non-food items to help those people affected by the earthquake.
It's important to have a mosquito net because the malaria is present in the world.
We were able to mobilise a network of healthcare providers who went out into the affected areas and found out what the situation was, particularly for pregnant women, women who are breastfeeding and children under 5. Because from our experience we know those are the most vulnerable in these kind of emergencies. Not only were we able to provide the healthcare they needed, but also the basic provision of food, water and shelter to help them survive out in the open. One of the biggest challenges of this response was the scale of it. This was a huge emergency and striking a country that was already in a humanitarian crisis. Not only that, but it also hit the capital city, which took out the government's ability to respond in any form. The huge logistical challenge was also a big impediment to the response. But we were able to counter this by mobilising our resources in Miami and flying supplies in from there, but also trucking them in from the Dominican Republic to ensure that every possible avenue to get those supplies into the children was used.
Oui, yo fait 2 fois. C'est important pour nous en pile parce que nous pas gagné pour nous bâtir moun yo.
Now, 6 months on from the earthquake, we're still providing those basic supplies to people, but we're also looking at the longer term needs. How can we get children back to school? We know that education is the future for Haiti. How can we ensure that women and children can get access to healthcare? But also, how can we make people less vulnerable to future emergencies? Hurricane season is upon us. We know that people are living in temporary shelters. How can we make sure that another disaster doesn't strike these people when they're at their most vulnerable?
Non, moi beaucoup aller à l'école, mais ça fait m'était année sam d'avoir l'examen, mais problème de terre là depuis passé pour jusqu'au n'y a plus que 4 mois, m'pas jamais à l'école, espace timoun, non espace timoun seulement. Grâce à mon Dieu, j'ai fait espace timoun pour moi, m'pas jamais à l'école. Mais si l'école t'a ouvert pour moi, c'est bon parce que l'examen année ça était très facile pour moi.
In an emergency response, education is as vital as providing food and healthcare and child protection. It's important to get children back into school as quickly as possible. If they can establish a routine, it can help with their psychological recovery and also help with their longer-term development. We know this from our experience all around the world and take leadership within the UN cluster system to make sure this can happen as soon as it possibly can. In somewhere like Haiti, where you're looking at a huge amount of the schooling actually being privately run, it's really important that we can provide the support for families to be able to put their children through school by providing the supplies they need, the teachers' kits, the school kits, as well as the actual facilities, the tents, and in the longer term actually rebuilding those schools.